Rose here. I'm finally making one of these vlogs again. It's been a while. I've just been so stressed out because applying to fellowship, a very competitive fellowship, but fortunately I got it, so now I can kind of relax. I am on my way to work right now. I'm on endocrine surgery. I should reintroduce myself. I'm Dr. Sanchez. I'm a 4th year surgery resident. I'm currently on the endocrine surgery service, and so I'm gonna take you through my day and kind of show you what I do. I'm gonna get some coffee. It's Monday. Your girl needs it. The struggle today, like Jesus. I don't say stress breakouts are a real thing because my face is doing well right now. This is like, we have not seen her in a while. You know, stress, acne, all kinds of chaos. I've got like this bizarre chronic sleep debt that no matter how much I sleep, I still feel kind of tired. We're working on it. I'm catching up. I haven't even been out or really done many fun things lately. I'm tired. Like every weekend that I'm off, I'm pretty much just sleeping. I know it's freaking bizarre. I always said I wouldn't become one of these people, but here we are. 4th year of surgery residency, and this is what happens. I mean, it's probably also old age because I'm turning 30 this year. Jesus. Let's chat a little bit about endocrine surgeries. In endocrine surgery, there's basically 3 main organs that we work on. The thyroid, the parathyroids, you have 4, they sit behind your thyroid, and the adrenal glands. We more commonly do thyroids and parathyroids, but we've been doing a fair share of adrenals lately. We're working with 2 endocrine surgeons. There are 2 residents on this service. Myself, a 4th year surgery resident, and then a 2nd year surgery resident. We don't have a lot of inpatients on this service. Most of our patients go home the same day from surgery. There are some times where we have to keep them in the hospital, usually just 1 night, maybe 2 max. Largely outpatient service. We don't have a lot of patients to round on in the mornings. a.m. We actually sent all of our patients home on Saturday, so there's nobody to round on this morning, which is why I get to get here at 7 a.m. because all I have to do is go upstairs and do the H&P, which is the history and physical for our patient that's going into surgery first. So I just have to talk to them, talk about the surgery, talk about the complications, talk about anything new that they have going on, so any new medications, any new health issues since they were last seen in clinic, which is usually not much because we see them soon prior to the surgery, so there's usually not a lot of time for change, but we always want to double check before we take them back to the operating room. We have our nice little loops and then my gym clothes for later. Patient, I put in the H&P, and now I'm going to see an inpatient. Actually still in the hospital for medical reasons, nothing surgical, but I'm just going to go lay eyes and make sure everything looks good. So here's what happened. I started to film that YouTube video the other day, and it got really busy, and I didn't have time to film for most of the day, and then I ended up just not filming the majority of the day. It was going so well in the morning, I thought I was gonna, get a lot on film, but that did not work out. To continue this video today, we are pretty much where we left off. I'm on the way to work. Gas, I'm on like 19 miles, but I definitely don't have time because I'm just cutting it close. I have a meeting at 7 a.m. where we basically go through all of the cases for the following week, talk about the patient, what they're having done, why they're having it done, all of their labs, make sure all of their preoperative workup is up to date and everything is in the system that we need. We do have 1 patient currently in the hospital, so we will see him as well prior to surgery. Start cases at 8 a.m., which is super nice, actually. We don't have time for Starbucks this morning. Fine, it's gonna be a great day regardless. This is our breakfast. Fruit, bread, cereal. post-op orders for our first patient. I grabbed some lunch. I did the history and physical for our second patient, and I think they're going back in the room soon. 2 more cases to go. The first case was a total thyroidectomy. It was quite difficult. We have 1 patient left. Finished up our second thyroid of the day. We went and saw our first patient of the day and we actually discharged them. Patient was doing great. Now we're going to do our third case, which is a parathyroid, which is a tiny little gland that sits behind the thyroid. Going to chop and protein shake. Say hi. Hi. Yeah. We made it. It's only Wednesday. Oh, good Lord. So our third case was a parathyroid case, but it was actually in the thyroid, so we ended up taking half of the thyroid. Everything went well, and the patient's in the recovery area. We went and saw them, made sure all was good. We checked on our second patient. We did all the discharge orders. We did the orders for the third patient. And now it is 7:06. I was going to go to the gym today, but I don't think I'm going to because I'm feeling a little lazy. I'm so hungry because I had a really fast lunch earlier today and it just did not cut it for me. So I need to go home and actually cook a decent Mexican meal so I can feel better. We have our morning education. We have M&M followed by a lecture, followed by a different lecture, which I'm giving part of. And then I have to actually present M&M next week. So I'm going to be working on that now because I hate doing presentations last minute. I just refuse. It freaks me out. So that was my day on endocrine surgery. Overall, I would say it's a very enjoyable service because most of the patients do really well. They're very thankful. There's not a lot of really sad scenarios or kind of death situations, which personally I like having positive outcomes. But I'm just looking at myself and I feel like in the past 4 years of residency, I have aged at least 20 years. I look like I'm 40 now. What happened? I just want to say thank you so much for watching. Thank you for being here. I will continue to post some of these. They just take me a little bit longer to edit, but get there. I have a whole year left in residency. We'll be rotating on colorectal, trauma surgery, general surgery, taking trauma call, general surgery again at a different hospital, surgical oncology, which is surgery of cancers, and vascular surgery. So it's gonna be a super busy year. I try to make as many videos as possible, show you guys the life of a surgery resident. Look at the day, it's literally so beautiful. Too bad I'm too tired to do anything other than go home and get some rest.